This is the Functional Rehab Podcast with your host, Dr. Ashley Mack.
Let's talk about the journey that you take when it comes to being sick or being hurt. For the most part, if you're like myself, you wait a couple days before, because you think that you can probably just heal on your own, but then a few days go by, things don't get any better, and you need some help. So you go into your insurance, you look at who are the providers in my area, and find out that the next appointment that you can have with your general doctor or your physical therapist is going to be weeks away. And what ends up happening is that maybe in those 2 weeks you get better, maybe in those 2 weeks you get a little bit worse. But why do we have to wait for such a long period of time to actually book an appointment with our providers? And why is it that we have to take so much time out of work to be able to just get access? And so today's guest is a very special guest. I've been following him for a while, and he has made primary care actually extremely accessible and convenient for the patients that he works with. And today we have Dr. Bryan Fine, who is based out of on the other coast, out of I think it's Florida. Yeah, Florida. And he was kind enough to share his expertise and share a little bit more about what he is doing. So Dr. Fine, it's so great to see you, and thank you so much for being on today's episode.
Thanks, Ashley. I appreciate you reaching out.
Yeah, and what I found to be most exciting was the fact that the way that you deliver your care is accessible, but also convenient for the patients. And the reality is that the way that our lives are is that we're just becoming increasingly busier. There's a lot of noise. There's a lot of responsibilities that we have to take. And your delivery model is actually very unique and exciting. It gives people an opportunity to actually access you wherever they are, whenever they are. And so, Dr. Fine, can you share with us a little bit more about yourself and how you got into doing the work that you're doing?
Yeah, no, I appreciate that. I've been a physician now, I guess a practicing physician now for over 20 years, and trained in pediatrics actually, and was in a hospital setting in a tertiary care environment for quite some time, but had always been interested in access and wellness and the healthcare system with a tablespoon of entrepreneurism on that. And so there was the point in my life where I decided to do something different and something that I considered to be pristine and the right thing to do, common sense. And so started working with patients where the ask of the patient was essentially nothing. It was just use your regular tools that you use in your daily life. In this case, it's regular text messaging, and then solve all the problems from there on my end of the equation. So I ask people and provide them my phone number for them to just text the same way they text family and friends with basic healthcare questions. I wouldn't call it exactly primary care, Ashley. It's more of a convenient care model that fills in the gaps between Google and the doctor's office. I actually help people find primary care if they need it, get the screening that they need. But there's also a lot of low-hanging fruit as far as simple health ailments that can be discussed asynchronously over time that allows people to not miss work, allows people to be with their family, allows people not have out-of-pocket costs. My core model is through employers. So it's a service to businesses so that their employees at no cost at all are able to text and get questions answered. And then as part of that journey, I wound up building the software so that patients, again, still just using a text message, they don't have to download anything. They don't have to log into any portal, but just using a regular text message. They reach out to a platform on my end that's web-based and that's integrated into a medical record. And it's going fairly well. Patients love it. Certain things that we can do for certain people, certain amount of the time. It's the model that we have is equitable. So it's frontline employees all the way up to CEO. And we just do the best we can. We tell people we'll help you the best we can.
I love that. Being able to make it work for the patient. I think especially, we'll say over the past, 30 to 40 years with the rise in new healthcare technologies, to me, it seems as if the, we'll say shift in power, or more so the shift in just the journey, where back in, the early, like the 50s, the 40s, and even before then, the doctor would actually go to people's homes and take care of them. And then with the evolution of various different medical technologies, it ended up transitioning into an office where patients would go. But when that happens, Yeah, patients, one, have to wait. Patients also have to take off from work or take time off or find coverage for childcare because they need to go to the doctor. And what ends up happening is that they have to move their entire life around it. And what I found to be really interesting when it came to that type of model is that when you're visiting with your provider, or the provider's visiting with the patient, or working with the patient, you're actually only getting a small sliver of what their life is like because you're speaking with them in that specific moment of time. In regards to, you're talking with the patient, it's kind of like a snapshot. It's like a Polaroid, right? Like, this is the information that I have. And oftentimes us providers don't necessarily always have the time to get all the necessary information in that one specific encounter. And so what ends up happening is that we're working off of an educated guess, where in some cases it can lead to a longer extension of care because we just didn't have the time. So it kind of gets spread out over the place. And so what's really exciting about your program and what you do is being able to meet the patients where they are and make it accessible to them, but in a way that allows the patient to be able to share the necessary information. In, it seems just the way that's delivered is that patients don't feel rushed when it comes to sharing information. And what's really nice about it is that it allows us to organize our thoughts a little bit more when we're texting back and forth. Is that about right?
Yeah, I think that's fair. There's some degree of healthcare. I think this gets lost. There's some degree of healthcare that can be delivered in a keyhole. Their patients are generally respectful. They're generally reliable, and you can ask questions and get a sense most of the time. You can also, as far as defining your scope of what you will do and what you can take care of, there's a lot of ways to sort of manage the incoming component of the interactions that you're having with patients. And then, absolutely. What I like about the asynchronous model, again, for non-urgent issues, we have to remember that even in our current model, urgency ultimately begins with a definition of the patient. They're sitting on their couch and they feel something, or they've been feeling something. They're the ones who have to make some sort of medical decision to decide whether to seek out care and how that works. And so to be able to reach out easily with questions that otherwise as I've described, I'm somewhere in between Google and the doctor's office, where they can get a little bit of human guidance in interpreting what they're feeling. I think it goes a long way, and they can send a message and then go to a meeting and then come back. Similar on my end, I can send a message, then get on a podcast, and then return a message an hour later. You setting expectations on how things are going to work. I think it goes really well, and most patients are very appreciative and understand. It's interesting you bring up. Yeah, there's something Rockwellian about it. It's like the technology is sort of incorporated into the 1950s model of putting the patient first, recognizing your limitations, while also appreciating and understanding that there's a lot you can do. Without patronizing patients, without treating them as though they're not capable in the vast majority of cases of understanding and collaborating in their own healthcare. And that's really the core of this.
And so let's talk about some of those non-urgent issues that you see that you're able to help your patients navigate.
Right. Some of the basic ones, obviously we deal a lot with, sinus infections, colds, congestion, earaches, sore throats. There's a lot of that. And, at a very high level, what's interesting, and there's a part of it that's the model that I've built as far as through employers where the employee's not paying anything. I found that it allows for a truly collaborative conversation, which frequently leads to better medicine. You don't have to prescribe an antibiotic. You don't have to do anything. And the patients understand that and can get behind it because they're not paying money with the expectation of getting something. In fact, or rather, they're appreciating this benefit that their employer is providing them. And so they are in a better position to talk with you, and you can say, well, listen, this is probably a virus. Let's see how the next day or two goes. The barrier to us pivoting and making a decision that's different is very low. You're not going to have to take off work again. You're not going to have to pay more money again. You're not going to have to log into a video platform with a new doctor again and convince them and revisit everything again. So let's have a conversation over a few days, because time it's a very, very valuable diagnostic tool. I'm sure you see this in the physical therapy space, where there's something going on where there's probably a good chance it's going to get better in a day or two. And so you can create these sort of interval plans, like, well, why don't we do something mild intervention or no intervention at all? But now you have me, so let's see how the next day or so goes. So a lot of those basic ones, medication refills, some longer, more complex collaborative diagnostic opportunities. I wish I wasn't needed. I wish all these things were things that people could find the answers to and get what they needed. But the goal here is just to provide a human being in this sort of purgatorial space of uncertainty to help people get quick answers.
Yeah, we're definitely in a world where, we're at the age of information. There's no shortage of information. Patients can actually get the same. I know patients can get the same textbooks that I got in physical therapy school. I can see them all on Amazon, right? And so you could do that. You can get the free information, such as podcasts like this and like the other various different aspects. And then there's also the opportunity for people to purchase digital courses, which pretty much is a condensation of whatever information that person putting out, but putting into a very structured way. And it's fantastic. People have access to that information, but there is a very big value added when you have a person behind it helping you navigate this information. And that's what I really appreciate about the service that you're providing, because you're absolutely right. You're providing a step beyond Dr. Google, and it gives people an opportunity to say, okay, I'm interacting with the human, which already you brought up this collaborative conversation. And really, when it comes to your health, especially when trying to overcome sickness or an injury, it's a collaborative approach where the patient needs to share the information that they need to in order for us to be able to make our decision. But then also we're presenting plans or plans of action for our patients to be able to say, will you be able to follow through with this, right? I see this in the physical therapy world where someone comes in and I prescribe, say, an exercise or stretching program, and it's one, the magic happens in the exercise selection, but also the magic actually happens when patients actually do the work that they were supposed to be doing in the first place. And so being able to have that conversation and collaborate, and I know that there's a lot of research articles that actually show the importance of a collaborative effort. So I'm glad that you brought that up. So let's talk about kind of like the typical journey that a patient goes through when they're dealing with, say, like a sinus infection. It's like, what usually happens if your model wasn't existing? What is that like?
Well, it's some combination of people don't seek out care at all, which, listen, most of those things get better, right? And so that's okay. If we could tell people, like, listen, don't worry about it. It's almost always going to get better. But then at the same time, we're telling people, things to be worried about. And then, just all of us want to get better sooner. So a lot of the things I help people either wouldn't seek out care at all, or they will seek out care in a sort of what tends to be a dissatisfying environment. They're going to go to an urgent care. They're going to try and reach out to their primary care. Sometimes hard to get appointments. So we are, again, this sort of middle space that picks off questions or permits questions that otherwise wouldn't be asked. Follow-up questions. I was at the doctor today and I didn't think about something, or there's something that came up the next day. I couldn't get my medicine, and they're just not handled well in the current model of portals and delegation. I function beneath my license. As a rule, to be honest with you, like the medicine that I practice doesn't need a doctor who's been practicing for 20 years. It's pretty basic stuff. I obviously have a good handle on what I know and what I don't know, I think. But this is basic stuff. Just trying to help people, trying to find answers. So yeah, it's that space that lets people ask questions they wouldn't otherwise ask, lets people get solutions to problems that are fairly minor, that they don't need a long visit to an emergency room and urgent care. Allows me to follow up, make sure they're getting better, make sure I did the right thing, make sure they got their medicine, their medication. Allows them to easily ask questions and follow up with the same person who took care of them. Doesn't need to be super technical because it's not video. It's not pushing people into video platforms where they can't get their microphone to work or their camera to work. It's let's just do this. Let's just use common sense.
And technology aside, you brought up two very resounding points when it comes to, say, like the in-person visits, which there's a huge value, right? There's things that they can do that you can't, and vice versa, right? In the current model today, in regards to in-person visits, we're talking about like really long wait times in regards to having to just book an appointment. And then the second part is oftentimes all healthcare providers are overworked and they're seeing too many patients. And so what ends up happening is the fact that these appointments are actually very, very long, very short, very, very short. And so from your standpoint, and especially with your experience being in clinic and then transitioning into this current stage of where you're at, why do you think that's the case? I would just be so interested to see from your observations, why are we experiencing such long wait times and short appointments?
I mean, I think it's the nature, right? The solutions that are coming out are targeted solutions. They're siloed solutions. I mean, some of them are good solutions. If you make a tool that makes it easier for physicians to document or therapists to document, and with that saved time, the therapists are expected to see more patients. Like, it sort of depends. It's, where's the holistic approach that makes sure the therapist or the physician isn't burned out, is a popular term, or overworked. There's just so many disparate interests and different stakeholders. It's some zero, somebody wins, somebody loses. So my solution, it's narrow. The save the world scalable component of what I do just would require other doctors to do what I do. It's not that difficult, but it's still not easy. But it's simple yet complex, because it would requires doctors to take risk, and not every doctor wants to do doctor by text. They don't feel comfortable, or they the barriers to something like that. They don't know how to start. It's hard. It's hard to get that up and running. But the concept is very simple. So I think a lot of the sort of funnels that we see that cause all these problems, I think it's from well-intended solutions that just get layered on top of one another. And I think it's complicated, and I got to the point where rather than trying to save the world with some broad sweep, I was like, well, let me grassroot this. Let me just help some people some of the time with some things where I have as much control to do something that's quality and that people like. And then, if things grow from there and other people want to do it, then great. I'm happy to help. And it's sort of a ground up approach instead of a top down approach.
And that way it allows you to do exactly what you're doing. And so let's talk about that experience a little bit more. You shared a little bit briefly in regards to it's very simple SMS, so patients don't necessarily need to download another app. Let's talk about what a typical experience is with you in regards to it's, a person listening right now is like, okay, I think I want to, work with Dr. Fine. I really appreciate this model. What's that typical journey like once they sign up? Like, do you kind of walk us through what those steps are like?
Yeah, so that's a good question, Ashley. Right now, I'm not doing very much direct to consumer stuff. So the people that I'm working with most as far as finding my patients would be in the business space, HR folks, people who run businesses who want to offer their employees something that's awesome. And that I do that for a few reasons. Part of it is it's easier on me to be able to manage both sides of it, the patient side and my side as a physician, as a provider. So anyone who's in a position where they work with people and they're trying to solve healthcare at a slightly larger scale than just their own individual health. Those are the people that I'm talking to most of the time. There's a lot of direct to consumer solutions that are out there. They're not quite the same as what I do. The other thing that I do, excuse me, typically for my clients is I also go on site periodically. And so it's not exclusively text medicine, but it's going on site. The employees get to know the person that they're texting with. There's a human part to it. I don't typically provide 24/7 coverage, as you could imagine. It's really just me. It's sort of more of a fractional chief medical officer approach. And that end helps define the scope, helps define expectations. So certainly anyone listening who is in a position where they want to help provide healthcare to a small cohort or a large cohort of people, and can find value in providing it so that their employees or that group of people doesn't have to take on expense. On my end, it winds up being a very trusting relationship. I've never had a patient abuse it. They're generally respectful. They know their bodies and they're reliable and they're honest. And so that's my approach.
Thank you, Dr. Fine. Medicine is expensive. There's a lot of long wait times, but the good news is that it doesn't always have to be that case. And so Dr. Fine's company and the services that he provides can be a really fantastic option for organizations to be able to provide the healthcare that is missing. And again, be a step further from Dr. Google. And so Dr. Fine, today was really awesome. I'm so glad that we were able to take the time and learn more about your SMS solution and just a little bit more, we'll say a broader view of the current medical system today. And so for the listeners who are in a position to be able to reach out to you, what's the best way to learn more about your company and get in touch?
Yeah, obviously, as you and I met, Ashley, I think a lot of people, the LinkedIn is where I do most of my sort of spiel and, preach from my soapbox. That's just, B Fine MD. My company is called Percentric, as in person-centered, PER centric. And there's obviously, so percentric.com. It's crafted towards the employer reader. And those are the main ways. Of course, you can text me. And that number is 757-818-8020. You can, I don't market. When people text me, I don't put them on a list and send out a bunch of spam or anything like that. All of my interactions by text are human and one-to-one and respectful. I use my texting as an access point for other people. I don't use it as an inbound opportunity, to get into their lives. So I'm happy to have any conversations. And certainly happy to have any conversations about how to make healthcare better for folks.
I love it. Dr. Fine, thank you so much. Listeners, if you did not get a chance to actually write that down, I'm actually going to be putting all that contact information into the show notes. Again, Dr. Fine, it's great to see you, and thank you for being a guest.
Ashley, man, I really appreciate the opportunity. This was a very good conversation. Thanks for the questions.
No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.